Welcome to the MedTrainer Chapter 1, Radiation Orientation and Safe Work Practices. In this chapter, we will cover regulations and safety requirements for imaging standards for ionizing radiation, radioactive materials, and the use of X-ray equipment. In 2012, the Environmental Protection Agency, EPA, proposed the Federal Guidance for Diagnostic and Interventional X-ray Equipment. This includes assuring that equipment is calibrated and functioning properly, that competent and licensed personnel operate equipment, and that the welfare of the patient is the principal consideration in the choice of equipment and treatment protocols. The general standards for protection against radiation exposure include protection from minors' occupational exposure limited to 10% of the applicable limits for adults. Females that have voluntarily declared their pregnancy shall not exceed 0.5 rem during the remainder of the pregnancy and should wear a dosimeter on the lower abdomen and exchanged monthly. All non-radiation workers, e.g. janitorial staff, secretaries, are to be provided with protection consistent with standards applied to the public for radiation shielding and occupancy limits. The International Commission on Radiological Protection, ICRP, has three fundamental principles for radiation protection that include justification, optimization of protection, and application of dose limits to achieve occupational and public doses as low as reasonably achievable, ALARA. For each facility that uses ionizing radiation for medical imaging, the NRC requires the administration of a qualified radiation safety officer, RSO. Personnel and area monitoring is required for each worker expected to receive more than 10% of the applicable dose limit should be required to wear one or more dosimeters. Procedures from the issuance and replacement of dosimeters documented, evaluated, and the records are retained as required by NRC and OSHA.